Dr. Begg, a very good evening to you. Thank you so much for being with us. So technically, when we speak about a cluster of infections or a cluster infection, what are you referring to and why is it so important in the context of this pandemic?
So when we have initial infection starting in a pandemic, we start off with the curves, as Professor Karim indicated a few nights ago, with travellers, so imported cases. And then we end up with contacts of those imported cases that are infected, and that forms the first part of the curve. What we're looking at now as local transmission starts to get embedded is clusters. Because we were so effective in part with the lockdown, is that clusters which are localized outbreaks. So in other words, we don't see infections throughout the population, but we see localized outbreaks in small geographic areas, which are called clusters. And those, at the moment, we're seeing in workplaces that are considered essential services, because those are the only places where people are getting out and congregating and working together. So those clusters tend to occur right now in healthcare workers, in police services or security services, and in supermarkets, because those are considered essential services, and that's where we're seeing people together.
And Doctor, that then speaks to the strategy that we've seen employed in other parts of the world in dealing with a pandemic, where instead of a national lockdown as we have now, there have been shutdowns of specific cities, specific towns. Is that where you see our lockdown having to go next if we are to tackle clusters effectively?
So it's a normal part of managing an epidemic to have clusters before you start to move into generalized community transmission. So we're already dealing with it effectively. If we didn't have lockdown, we would see dramatically more clusters in all likelihood. The challenge is post-lockdown that the virus needs legs. It can't walk by itself, and so it uses humans to connect with other humans. And the challenge with lifting lockdown is that currently we're only seeing those clusters in places where we have essential services, because they're the ones who are moving and connecting with each other. Post-lockdown, if we're not careful about making sure that people still don't congregate and aggregate in big groups and don't connect to each other, then we're likely to have significantly greater community transmission. So yes, managing clusters is really important to swiftly do, which is what we're doing right now. So supermarkets who are having a cluster, we get in there as quickly as possible and quarantine those who are not positive, isolate those who are positive, and so don't give the virus any more legs than it needs. And the same happens in hospitals and in other spaces where people are currently congregating. So it would be very important to manage the clusters, but also make sure that we don't have more clusters in other areas. So in part, having partial lockdowns is effective, but also really making sure that we actually don't allow anybody to congregate in big groups going forward, probably for the remainder of the year. So classes, weddings, funerals, parties, all those kinds of things really need to be considered. And we all need to make sure that physical distancing becomes a way of life, certainly until the end of the year.
But it also requires a great deal of honesty then to manage the clusters, because we've been hearing allegations from health unions that in some instances hospitals have not been as transparent as they should be when a staff member becomes infected.
Yes, and it's difficult. The transition from an individual being infected to a cluster can happen relatively quickly. So I think we shouldn't be too harsh on them. That this is just the nature of a pandemic. I think we try to see problems or that people are hiding things a lot more than actually happens. A cluster we dealt with over the weekend in the Western Cape literally occurred from Friday, and by the time we got to kind of Monday, and the cluster head had really dealt with it appropriately. But it just moves so fast. And remember that in this particular pandemic, many people are positive before they are showing symptoms. So in many events, we have asymptomatic positives walking around. We don't know that they're positive, but they are transmitting and infecting others before we're actually able to diagnose them as being positive and isolate them at that point. So we really need to all be considering that we are all behaving as if we're all positive and making sure that we are not transmitting to others. So that means physical distancing, washing our hands, doing all of the 5 golden rules, and linking to your previous speaker around masks, remembering that my mask is not worn to protect me, it's worn to protect others. So my mask protects you and your mask protects me, which means that we're treating ourselves as if we are positive and making sure that we're not infecting others.
Dr. Kerrin Begg, a public health medicine specialist from the University of Stellenbosch, always good to speak to you.